All right, to be respectful of time, we're going to go ahead and get started. So, thanks everybody for joining us today. This is our webinar series for our One Health Forum community. And Heather has been gracious enough to talk about her recent publication that came out. Um, sorry, we're having a little bit of technical difficulty, but topic today, expanding access to veterinary care through initiative financing. A little bit about Heather, you may have read. Heather's a certified animal welfare administrator with a master's degree in economics. She began her career in financial and social economics before devoting her career to advancing human ethics. She has 20 years of experience leading the animal welfare advancement. She's on the leadership team for Open Door Veterinary Collective, a 501c3 with a mission to expand access to veterinary care and pet services. She also directs the organization's public service site, www.pep.pethelpfinder.org. She also shares her off-grid Colorado home with her partner, Dan, and their 5 beloved adopted dogs. So welcome, Heather. We'd also like to welcome Amber Gilmore. She's the president and CEO of the Pets Clinic. Amber's a proud Texas Tech University graduate with a lifelong passion for animals. Her commitment to animal welfare began when she served on the committee at Pets Clinic Board from 2018 to 2023. She went on to serve as the executive director of the Wichita Falls location from 23 to 25 and became the CEO of Pets in January. Amber's love for animals is not just professional. She shares her home with 3 cats and 1 dog, reflecting her personal dedication to the pets she serves every day. So thank you very much, ladies, for joining us today. I'm going to go ahead and mute myself. We'll save a time for questions at the end, but as you think of questions, please put them in the chat and we'll make sure to bring them up at the end. So I'm going to go ahead and turn it over to you, ladies.
Wonderful. Well, thank you so much. It's great to be with everyone. And T, thank you so much for putting this together. T and I have worked together for more years than we'll publicly acknowledge. Wonderful partnership with the folks at University of Tennessee. Everything from Meals on Wheels research, looking at pet programming, and way back, spay, neuter, and so forth. So it's great to be with you, T. And I certainly want to acknowledge Amber, who is joining us today. Amber was one of the participating clinics in our study and was offered very generously to be part of the dissemination of results and to be able to share for Q&A, because surely you're going to have a lot of questions. So I will go first. I'm going to share my screen. Bear with me. And let's see what I can see. I can only see Amber. So Amber, you're going to be giving me feedback to make sure that it's up on the screen. Okay, great. And then I will move over slideshow from beginning. Okay. So expanding access to veterinary care through innovative financing. Thank you to everyone for putting where they're from all over the country and in fact, all over the world. So Open Door Veterinary Collective, quickly, if you're not familiar with us, we are a 501c3 nonprofit, and we are just completely dedicated to expanding access to veterinary care and pet services. Our website is there down at the bottom. I'd love for you to get to know us. We've got a lot of materials for veterinary social workers, veterinary teams, clinics, animal welfare professionals, just a lot. We've got a great team. Hope you would get to know us. So please check us out. We were founded, now about 6 years ago by Amy St. Arnaud, who some of you may know from work in access to spay neuter and the Humane Alliance high volume, high quality, low cost spay neuter model, of which she was a key part. And essentially, Amy said, can we do what we did with spay neuter in terms of efficiencies and disseminating an access to care model and innovate to make this more affordable and accessible for all veterinary care? And so she launched 2 private clinics, tested out all these things and packaged them up. And we work and continue to innovate and share. And you should feel very badly for her practice managers because they test out all sorts of innovative approaches and are part of a lot of our work with the nonprofit and help us out a lot. We also launched pethelpfinder.org. That is our public-facing site. And it has over 6,600 resources across North America. We certainly hope that for those of you who run programs, that your programs are listed up there, and we work to get some great programs for you. And this site is free to use, free to be listed, and we're really thrilled about it. It's really getting out there. We just saw something about 2 million impressions last year. So this is the study that we're talking about today. I know T had encouraged everyone to take a look at it ahead of time, but we'll certainly have time if you didn't to talk about Q&A. But if you take a shot of this, it'll bring it up for you. So what do we know? We certainly know that finances are the top barrier to care. Nothing new there. Thanks to the AVCC report from University of Tennessee, Program for Pet Health Equity, they found that more than 1 in 4 pet families could not access needed veterinary care. And the question was in the past 2 years. The overwhelming barrier, no matter how you cut the data, was financial. And so we're going to really key in on that term, financial. Last year, PetSmart Charities released data, and they've been releasing a lot of data. If you haven't seen it, they just came out with, and I know we have someone from Canada, but they've been doing research on pet families and separately veterinary professionals, both in the US and in Canada, and they've been releasing that data. So in 2025, they released pet family data on access to care in US and Canada. And in 2026, they've just released survey data from veterinary professionals, US and Canada. So please check that out if you have not. I have a link at the bottom of the screen, but it's pretty easy to find. And they found that among pet parents who say they've declined care or foregone veterinary care in the past year, which was a pretty big number, finances have impeded the ability of at least 2/3 of pet parents. And again, no matter how we cut the data across age, race, income groups, to provide their pet with needed veterinary care. So again, financial, the biggest barrier over time, no matter how we cut the data. And so what is the pitch? Well, we take a lot of time and look at the American consumer and the realities of the American consumer. In Canada, we also do look at Canada data as well. Few clients, and I know our person from the UK will be surprised by this in all likelihood, but few clients have pet insurance here in North America, and most are reimbursement model. And what that means is that the person gets reimbursed after paying the bill up front. Then there's where we hit the cash reserve challenges. So it's only about 4.5%. The number varies between 4 and 6% pets having pet insurance. We have a high prevalence of financial fragility. There's different definitions of that. You'll see one that's, could you come up with $2,000 in 30 days? And again, this is not just related to veterinary care, but we do, thanks to PetSmart, have some data specifically related to veterinary care. This is, could you absorb a major shock to your household, an auto repair, health bill, veterinary bill? 63% of adults in this country could pay for a $400 emergency bill. This is not veterinary care. This is just a general emergency bill with cash or its equivalent. They consider an equivalent, you could put it on your credit card and pay off your credit card with the bill comes in. But only 63% of adults could come up with $400. Thanks to PetSmart, we have some specific fragility measures around life-saving emergency veterinary care. And that's 65% of pet families report that they could pay $1,000 or less for life-saving care for their pet. So that gives you that sense of like, what kind of reserves do pet families have? A lot of people live paycheck to paycheck, primarily living paycheck to paycheck. Some of the latest data that I saw from last year, 40, and you'll see different measures of this. You know, it's like, do you cover all your super essential bills? And then they widen it a little bit. So when you see different stats, they may look a little different. I liked this definition, but 40% um, living primarily paycheck to paycheck. And of that, maybe just got a little note here about 45% of millennials. And that is really something we all need to focus on because who owns the most pets? Who's the biggest piece of that pet owning pie? It's millennials. Um, and so to dig a little deeper into that, we also know that 22% of millennials had a quote major financial hardship in the past year. So these are all the factors, right? When people are walking in the door and they need veterinary care, maybe they've already had a major financial hit, they're living paycheck to paycheck, they don't have cash reserves. And then there's a lot of people that don't have credit, either inadequate credit, they're living at their limits of credit, their file is what they call too thin to be scored. So think of, an elderly owner paid off their home 20 years ago. They don't even show up really on the credit file. And so they're not going to be approved for some of the tools that are used in VetMed. So this is our pinch. And the most common industry payment offering when offered in VetMed is a credit-based 6-month financing tool that is decided by a third party. So the decision is really outside of the hands of the clinic. Just a few, charts and stats to back some of this up. Approval rating by credit score tier. You can see it drops off very quickly. General purpose card would be like your, you can use it for anything. Private label is often like you have to use it specifically for certain care, like a medical credit card. And a substantial and rising portion of card holders were found with subprime scores that they're nearing their limit on their credit card. So people, again, don't have that room on their card. Average credit lines aren't really that high, especially once we get into some of the not super high credit tiers. And we have a real equity issue. This is a chart that shows you consumers reporting that they were denied credit or approved for less than was requested by race and ethnicity. And so that you can see over 50% in 2024 of Black consumers reported that they were denied or approved for less than they. There is some good news here. Cost of care is a subset of financial barrier. So we certainly, the costs are rising and they're outpacing inflation. There's tremendous pressures on the veterinary industry. Cost of goods are rising rapidly, labor costs are rising rapidly. And there's a lot that we can do on cost. And so that is, certainly evidence-based spectrum of care, meeting people with treatment plans and approaches that address financial barriers. So certainly there's things we can do to try to address the price of care, but a financial barrier, that is not the entirety of the barrier people face when they say financial. So we're going to go back and we're going to do a quick little bit of economics. So middle of the day, hopefully everyone's still, pretty well caffeinated if you're a coffee drinker, but not offering payment mechanisms needed that make the market not clear efficiently is what we call a market failure. So we're going to go back and we're going to do a little bit on our P's and Q's. So I don't know if I can't see everyone. I was going to ask you to raise your hands if you ever took a microeconomics course, but I know many people may not have in the veterinary industry, although we certainly have MBAs and business people. But essentially, as the price goes up for something, quantity that we demand goes down. So we have a downward facing demand curve for items. And so at any price, and we'll call this P naught, we come over to our demand curve. The amount that's demanded would be this Q quantity, Q naught. So again, as price goes up, we would move to the left on the curve and we would demand less quantity. So again, downward facing because as price goes up, quantity demanded goes down, and the cheaper something is in general, right, the more of it we can acquire or we want. When we fix market failures in economics, we shift out a demand curve. How many people would have a house if there weren't 30-year mortgages? How many people would have cars if we couldn't finance them for 4 or 5, now even 6+ years? So it actually shifts out a curve when you fix a market failure. And that includes any market failures, information gaps, and otherwise, when we fix them. So here we fixed and we've added ways for people to pay for the bill. It moves out a demand curve. And again, this is our sort of economic framework. So now the same exact price. So we didn't change the price of the services. We move over to our new demand curve, and the quantity demanded and achieved goes up. So that's the basic principle behind addressing financial tools that meet consumers to enable them to acquire veterinary care. And where you see this show up are quotes like this. So this is from the PetSmart Gallup data that nearly 2/3 of pet parents, 64%, said that payment plans would enable them to at least double the amount they could afford to pay for life-saving care for their pet. However, fewer than 1 in 4 parents had ever been offered such a plan. So when you read that quote, this is what's happening behind that quote. So again, this is the study. I do want to thank PetSmart Charities. This was my little prompt so that I certainly didn't forget for funding this research. We had done research on a different payment option a few years ago, published it, said we really want to learn a lot more and look at more things, and thankfully they funded it. So the study structure, it was a 12-month study. We had 16 clinics. Amber was one of those clinics. The tool that was studied is Verity, which is no credit check whatsoever. So we take away that whole credit issue. Automatic approval up to $4,000 under some very basic conditions. The monthly payment for the person can't exceed a certain percent of their self-reported household income. We asked clinics to add both two tools to whatever they used at the clinic. And this was an observational study. We did not prescribe, hey, use Cherry first, Care Credit second, Verity third. It was up to clinics, and they could change how they use the tool over the time period. So we said, please add these 2 tools. The guaranteed tool, and what that does is no credit check. The clinic is guaranteed payment. And a non-guaranteed tool, because we found really high repayment with another third-party managed payment plan years ago, and we would protect them if clients didn't pay the bill up to a certain amount that we told them ahead of time, and that was based on how many full-time veterinarians they had. So they could offer both of those tools, and again, when and how it worked for them, and they enabled us to see the data and observe it. Every client that utilized one of these payment options at the clinics was asked questions: why are you using this tool? And what alternatives did you face in the absence of having this option to pay for your pet's care? And they were asked that at the time that they set it up. There was a lot more we wanted to know, but we were very sensitive that this could be a very bad moment, that this is the time of the front desk in clinics. We started the study a couple of years ago, so certainly appreciating that everyone was still feeling enormously understaffed. And I know a lot of you are saying, hey, we're still understaffed. And what did we find? We found that the clients who use this tool to pay for their vet care at these clinics, 35.8% faced a severe risk to the human-animal bond if the payment option had not been made available. And those were clients that said they would have been very likely, not likely, somewhat likely, very likely, either give their animal up to a shelter, another person, or put their pet to sleep if the payment option were not made available. When we added responses, very likely to seek care elsewhere, forgo care, go home, see how it goes, etc., 52% of cases faced what we would call a severe risk to the clinic client patient relationship. The average term that we saw the clinics use was 9 months. Again, if you kind of go back to that first slide when we talked about the pinch, most clinics, when they offer financing tools, it's a 6-month period. So that 9 months is telling us like that 6 months of payment each month is too high and the clients probably can't afford it. Those are going to be our folks, right, facing interest and penalty risk with some other tools. 76.1% of users were existing clinic clients of the clinic. I think when we talk sometimes about expanding access to care, there's always this perception that it's, oh, well, new clients, we don't need new clients. We were so busy. That is calming down now. The doors aren't swinging as much as some people in the industry say, with 32% having 4 or more previous visits with the clinic. So this certainly served existing clients as well. Something that the clinic showed us by their behavior was that they overwhelmingly used the guarantee tool and reported it very important in our surveys to them. And I called some of them up and I said, why? I've got grant money to protect you on the non-guarantee tool. Like, why are you using it? And we heard a lot of responses, but things around, well, we don't want to offer something we're not going to offer in the future. So certainly Amber can share more about that because I was calling people up saying, why aren't you using it? I have this grant money for you. You are paid with this tool as the client pays. And then if they don't pay, you trigger the guarantee and you are paid the original amount on the original schedule. Oh, excuse me. So I present in the paper a way to consider a time value of money so that you can do an apples to apples comparison, thinking about what your triage will be at your clinic. All right, I'm going to move along because I don't want to take up Amber's time. And we also found that the repayment, even though it didn't really matter because most plans were the guarantee tool, the repayment, when we looked at it, suggested that clinics and clients were using this well together. Because it certainly is a conversation with you and your client. Like, how much can you afford each month? Okay, we'll do 9 months, 10 months, because you get to pick together the terms. It's not this third party yes, no. Coming soon, we're going to share some additional research we did. And thank you, Amber, for participating in that as well. Where then we said, okay, well, you've met a certain tier of people's need with just adding a payment option. Now, what if you combine some of your angel funds to meet people with a payment they can afford with a tool that guarantees payment to you? What does that look like? What did that do for you? What did you learn? So we're going to be sharing that out and hopefully come back and see you all here. So I just want to say that there is a growing perception out in the world that veterinary care is not accessible. There was a paper in JAVMA that found that people who were financially fragile, they used that $2,000 definition, actually had lower perceived ability of being able to access veterinary care in their community. And PetSmart data also gives us plenty of little points that would suggest people are hearing that friends, family are losing their pets because they can't afford veterinary care. So once we even add options, I just want to say, like, we've got to do a good job and let people know those are available. And that will also move out people seeking care, hopefully when they need it and not wait. And then deferred care is more expensive and really puts them in bad positions. So some of the key takeaways: expanded payment options offer a way to mitigate the financial barrier. It's not just the price of the care, although hopefully we're all doing great things with spectrum of care and otherwise and efficiencies. We can preserve the human-animal bond and clinic-patient relationship. There are growing options in the veterinary field, and we present the paper that we really should view finance partners as not some transactional outside entity, but really try to work with these companies and individuals at them to be collaborators in meeting this mission. And again, with no price change whatsoever, quantity of care increases. So I'm going to turn it over to you, Amber. I'm going to mute myself. Please just prompt me to move ahead on the slides.
Thank you so much. So this is pets Stands for Preventing Euthanasia Through Sterilization. We started as a spay and neuter clinic doing prevention, spays and neuters, and some vaccines. And in about 2018, we polled our clients and they told us that we were their veterinarian. When we were like, no, 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 we're just a spay and neuter clinic. We give you rabies. And so our past founder and CEO decided that, well, if we're already their veterinarian, we're going to make it happen. And so in 2020, we became full service. So go ahead and push forward. Oh, I can. I think I can do it. So we provide oh, nope. There we go. So we provide high quality veterinary services to underserved persons in our community. We serve over 20,000 pets annually in the Wichita Falls and surrounding area. Wichita Falls has about 110,000 people, and we see a lot of the rural community as well. We opened two other satellite clinics in 2019 and 2020 in Lubbock and Amarillo, Texas, and they are primarily spay and neuter. With the Verity process, we only utilize that inside our Wichita Falls clinic, which is our full service. Our mission is to keep pets in homes, um, keep them in, and removing financial and access barriers at all times. Go ahead, Heather. So when we became full service in 2020, we tried a bunch of different things with helping our clients afford these services that we've never offered before. And so we questioned ourselves. Okay, well, we started a in clinic payment plan, and if you've ever done that, you've probably know the struggles that it is time consuming, it's overwhelming, and it's not super successful if it's not ran properly. And so we got the opportunity to offer Verity in our clinic. We wanted to make sure that we maintained affordable costs for our clients. This has been every year when we increase costs due to supplies and overhead, we always keep in mind that we cannot outprice our clients. And so we wanted to make sure that we're not compromising our sustainability. We want to be around for a really long time. And so when Verity came along, it was kind of a no-brainer. So we were seeing clients who needed care but struggled to pay for the full price at the time of service. And that's not for our spays and neuters. Our spays and neuters can be as little as $0. These are the services like a dental or emergency costs, lumpectomies, mastectomies, those sort of things that are higher dollar that our clients, like you saw in the research earlier with Heather, those are our clients. They're not able to have traditional credit with high, credit limits. Those are not our clientele. If they have debit cards, they're cash cards, and my cats are going to come and say hi every now and then. So just an FYI, the struggles of working from home. Go ahead, Heather. So we're looking for a solution that didn't cause us any risk, didn't hinder our clients from being able to live their daily lives. And so there was some hesitations when we first started. How are our clients going to respond to this? How are our staff going to respond? I'll tell you, our staff responded with a lot of pushback. I was saying recently that they pretty much told me no. And they said, we're not financial aid consultants. We don't have these skills. You're making our jobs harder. We can't do one more thing. And the neat thing was that happened was our staff realized that their ability to educate clients on this third party option that affected a lot of our clients because, as I stated, they're very low income, no traditional credit sources. This was their chance to be able to save the life of their animal, either save their animal's teeth so they can have a better life or to get those lumps removed. And it's just been so beneficial since. And so after we looked at the study and saw the results and what we could do with it, like I said earlier, it was a no-brainer. We were going to implement this into our clinic and just had amazing results. Go ahead, Heather. So, what we learned. Change always brings hesitation. As I stated, the staff were not on board right away. They didn't want to add anything like to their plate, but we resolved that. They were worried that this was going to hinder their ability to see more clients. If they're having to have these financial conversations with clients, it was going to extend their appointment time, to delay other things, and that was not the case. Once they were able to get a few accounts under their belt, they were able to realize that it didn't take very long. I would say it takes anywhere from 4 to 8 minutes to sign up someone for Verity. The longest time that from start to finish is getting the estimate done. Once we have the estimate, we're able to sign them up for a Verity right there, depending on how much they can put down for that initial payment. Clients were hesitant for a different reason, like our staff. They questioned the ability of a company to not ask for a credit check and give them money. It sounds suspicious. And so the clients were hesitant, but our ability to, again, educate them with how it works and how, the system is and the organization that we were working with, they soon learned that it was legit. So that was nice. And, offering those payment flexibilities, I really don't know many of our clients that could pay for something more than $200. I would say our average transaction every single day is $68 in our clinic. Average transaction amount, $68. And so that's probably crazy low for some of you guys, depending on where you live. But that's the norm. And so these higher prices, the emergency costs, parvo, pyometras, these were things out of their cost range, but life-saving. So that's what we used it for. Go ahead. And so the impact. More clients received timely treatment. And I'll say that in a sense, we had a client, one of our very first, I remember it was one of our very first Verity clients. And I remember him because he was Hispanic. And I don't remember him just because he was Hispanic, but he didn't speak English. And we have veterinarians from Mexico on staff. And so that was one of our first clients that we had to explain, first of all, veterinary cost to and Verity in a different language. And so I remember it very clearly because this was kind of a big deal. This was kind of setting the tone for us being able to offer these services to our clients who English is their second language or they don't speak English. And what was neat, he brought his dog in, there was a dog fight, able to sign up for Verity. I think it was like $900, paid it off in full. And then something else happened to his dog 6 months later, and he was able to sign up for another Verity. And that just worked for him. And he asked for it the second time. We didn't even have to offer it. And so that just goes to show how this has really impacted our community. We had fewer delayed or declined services due to financial barriers. I'll say in our clinic, Facebook fundraisers are very popular, but it takes anywhere from 7 to 14 days for people to raise the funds needed. And for those urgent veterinary needs, it's not possible to wait that long. And so Verity allowed us to start working on them right away. What I really liked was that it was guaranteed. We could start working on the patient, and then walk the client over to get them signed up for Verity because everyone is approved depending on the amount that you can sign up for. It really improved client trust and satisfaction. We don't offer Verity to everyone. It's not an automatic thing for us. We ask those questions and we ask, what can you afford today? We determine the estimate amount. We determine a bunch of things before we offer this. If you have a MasterCard with a $5,000 credit limit on it, we're not telling you about Verity because what you have works for you. And so this was really the last option for a lot of clients, because in about a 2 hour range, there is nothing less expensive than Pets Clinic. And so those questions that Heather was talking about really resonated with our clients when we're asking those questions at the end of the application process. One of the questions is, would you take your animal somewhere else? In our community, there is nowhere else. We're it. And so if we couldn't sign them up for Verity to get approved for this, they didn't have another option. It really reduced emotional stress during decision making, because our clients, we tell them the estimate, and you've probably had similar expectations, like, okay, here's your estimate, let's go check you out. And these people are like, I can't even afford half of that, let alone the whole amount. And so with those, it's very stressful in those situations, not only for the client, but also for our techs trying to explain these situations. And so it really helped, especially when our staff became more comfortable and confident in that. And so where are we now? We're about 3 years into using Verity, and we open approximately 2 to 3 applications, contracts every week. We're building a model that is balancing compassion and sustainability, because without this, we wouldn't be able to service some of these clients, and we would have to humanely euthanize. And nobody wants that, especially for a patient who is treatable. When we remove financial barriers responsibly, pets stay in homes, families stay intact, and communities thrive. And that's who we are and what we do in Wichita Falls.
Thank you, Amber. We're going to open it up for Q&A. I just wanted to share, Amber had joined us. Because of the research and the findings, we went to the Dave and Cheryl Duffield Foundation from Open Door, and we said, we really feel that expanded payment options, a really robust angel fund at clinics where we put money in the hands of providers all over this country, again, for those decisions that need to be made right there, and you can't wait for online fundraisers or grant programs that take a while to get back. That combining some of these tools, and again, we're going to share our research on the Angel Fund soon, but these tools will be very powerful in overcoming and enabling not just clinics to say, clients to say yes to care, but clinics to be able to say yes to care. So we're very grateful to the Dave and Cheryl Duffield Foundation. They are getting behind this. We launched it at VMX this year. And Amber was just with us at WBC sharing her experience. And so the Duffields are donating $5,000 to clinics who would like to participate. That is $4,500 donation to an angel fund, and $500 to connect into the PIM. So it's all paid for. So just wanted to share that QR code. It's called yestocare.org. Please take a look at that. But it came out of all this work and research. So we are very grateful to Amber and the clinics that were willing to take on one more thing on a really stressed system and try it out. And then questions and discussions. So T, I don't know if you're going to help us with that, or I can jump into the chat.
We only had one question in the chat, and I believe you answered it. Is the recommendation to show the payment option broken down monthly for all clients, or just those who express financial concerns?
So when we give them the estimate, we ask what they can afford today if they're not able to pay it all in full, because that's ideally we want them to pay it in full at the time of service. So when that's not an option, we ask them, what can you afford? When they give us that number, we know how much we can sign them up for Verity. If that number matches the estimate, then we're good. If it doesn't match, if it's too low, then as Heather was saying, we can use some of our grant dollars or angel funds to make those two things match. And then we discuss how long they can pay it off for. So I usually, when I set them up myself, I tell them in our clinic, we have a specific calendar or specific schedule of if it's this amount to this amount, this is as long as they get, this amount to this amount, this is as long as they get. So we start there, wherever it falls, we say, okay, that looks like it's going to be a 12-month service or 12-month payment plan. And that's going to be this dollar amount. Does that work for you? And I'll say 9 out of 10 times that number works for them. That one time where they say it doesn't, then we increase the number of months they pay it off. And so that's where we have a guideline that we start with. Does that answer that question? I think that's what it's asking.
Thank you, Amber. Have you found that clinics owned by private equity firms are interested in participating? I ask because many, maybe most, of the clinics in New York City are now owned by private equity firms.
Yeah, that's a great comment. Thank you. Absolutely. When we are at these conferences sharing this new initiative with the Dave and Cheryl Duffield Foundation, we get a lot of people who work at those clinics, and they very much, because they're the ones dealing with this, right, day to day. So we did have some corporate entities in the study. I will say they were lower users of the tool. It takes longer to get through. We talked with many about the study, and there was such interest at the location. But as soon as it went up the ranks, there was concern about the data use agreement. There was concern about this, or they would pick one location to be the test location. The good news is that thanks to these clinics and this study and our nonprofits, because we had for-profits, nonprofits, we had a couple corporate, the nonprofits just blew it out of the water. I mean, they became the biggest users of it. And that was a little bit of a surprise because they were the ones at the beginning that were like, well, our staff really enjoy giving services away. That wasn't, Amber is very laser focused on sustainability for her clinic and being so affordable. But, the idea of another tool or financing is not necessarily, nonprofits aren't always the first adopters of business tools, right? Like, let's just say that. And I love my nonprofit community. But they really saw what it did for access to care. And so I really think they're going to be influencers in this space. And now with the Yes to Care initiative, I can share that we have large entities, and we're actually like, oh, wow, how do we make sure they don't take up all the slots we have in the Yes to Care initiative? So, it is, I think we can do a lot by encouraging consumers to expect that payment options are available out there and that they should look for them. And I think we need our workforce to see the power that they have, that this helps them do their job. It helps them meet their professional and personal missions. And so they want to work somewhere that offers, make sure that they're doing everything they can to help people. And that's what we saw in the results. Even clinics, as you share, that didn't use it very much in the study, they said it meant a lot to our team to feel that we offered everything to try to help clients. So they recognize the impact on the team. So I think those are really strong levers for getting broad adoption of payment options in the marketplace. I hope that answered the question.
Thank you. Bonnie says, I'm in Canada, worked in the traditional financial services industry and specifically credit for many years. I'd love to know if connecting could be possible to learn more about the background of the offer, the specifics of how it works without credit details, etc.
Yeah. So I would encourage you to read. Severity is not available in Canada. So we're unfortunately not able to pull in clinics to the Yes to Care initiative, but the Angel Fund tool is available, and certainly everything we do at Open Door with skill building around financial conversations is available. But I would encourage you to reach out to Verity. If that's something you or your company may be looking, maybe you can do some kind of licensing deal, or you guys could work out some deal and bring this to Canada, because we get a lot of interest from Canada about this. And I'd be happy, if you want to email me, I'd be happy to make an introduction.
Thank you, Heather. Jean says, how can we find participating clinics?
So participating clinics that use payment options, we have added payment options to as a search category on pethelpfinder.org. So, and then we try to identify what tools they use. So we will say things in the description like this clinic offers Verity. Please contact them directly for when and how it is made available. Because as Amber shared, and we hear from other clinics, some only use it for emergency cases. Some, don't enable it to be used for wellness or regular care. So we try to support the clinics while at the same time making so that there isn't a misset of expectation. While at the same time, we believe this is such a powerful way to expand access to care in a way that works, for everyone, and they use it as it worked for them. That it is a search category on pethelpfinder.org. So I do know that we have a lot of social workers, thanks to our colleague, Dr. Janet Hoy-Gerlach and others who are getting that word out so that people who help pet families with services know that they can look it up on pethelpfinder.org. And then the Yes to Care initiative, that is brand new. We are just signing on the clinics now. So we do not have those listed, but they will be on pethelpfinder.org as well.
Thank you. Are these tools available to rescue organizations or only to individuals?
So these, if you have a nonprofit that runs a clinic, you can absolutely use all these tools. You can be part of the Yes to Care initiative. We just so we've had them in the studies, and these tools are available. There are some groups out there in animal welfare that are using tools like this, whether it's vet billing or Verity, to address a range of animal welfare challenges. So that could be pet deposits for housing. It could be reclaim fees if to help people get their animals reclaimed, especially if there were veterinary charges or other care provided to the animal and the person can't afford it, but we certainly want to get the animal back into the home. So there are some creative ways to do that. So I would encourage you, please reach out to me and I'd be happy to, based on your situation, maybe help make a recommendation of avenues to pursue. But there is some other creative uses of it. If you're not the direct veterinary provider, maybe the clinics that you work with, directing them to the Yes to Care initiative, letting them know about these tools, sharing the research, and then we'd love to be connected with them.
Thank you, Heather. That's all the questions we have in chat. Does anyone else have any questions?
So while maybe some people are thinking, I'll preview some of the results. I can't share them. Otherwise, we can't publish them. About the using angel funds to meet clients with a payment option they can afford. We worked with 3 amazing nonprofits, one of them being Amber, and we focused on working with nonprofits because we thought, there's a lot of experience that they bring to applying grant funds, having grant funds, the opportunity cost of using grant funds here versus there, and they'd be really able to, share with us and really hit the ground running in that study. One of the 3 nonprofits, they have 2 clinics that they use the tool at that do a lot of work. And they found that they didn't have to use much of the angel fund, that Verity met a lot of their need. Overall, when the clinic subsidized, they were able to turn $1 of angel fund into $3 of care. So that was about the average, meaning $1 came out of that angel fund. The client paid the 2 of the $3 using a Verity plan they could afford, and with guarantee to the clinic. We didn't even try saying, do you want to use the non-guarantee tool? Because we heard loud and clear how everyone felt about that in first study. So a little preview there. Don't know if that prompts any question.
I'll say that's a big thing for us is making sure that our clients are paying something towards the care. We've just been able to see that if they pay something, they have more of an interest in what's happening, and the subsidy that we use with the funds were greatly appreciated, and we were able to help a lot of people with that.
A lot of families were helped. Question. Chet asks, is the financing available to rescues to pay vet care bills if they use a vet clinic that participates?
Oh, that's a great question. It is I see now question earlier. That one, it would probably have to be based off of an individual because it's an individual that is responsible for it. I don't know that they've ever used, even though, right, if you're incorporated, corporation is an individual in the eyes of the law. That's something I would talk about with Verity, but I think it's going to come down to like you would use an individual to guarantee it. Just like any of us who have run a nonprofit, right? Our social security's out there for the Home Depot card. Um,
I would say too, the how most of the rescues pay my clinic is through checks. And so with that just being part of what we deal with Verity, you have to have a debit or credit card that is you put the finance and then you pay monthly on it. And so like Heather was saying, it would need to be a specific individual. The contract holder would need to be a person, whether that be, the president or somebody in that rescue. And then if you had your organization had a card to put it on, I mean, I don't see why not, but yeah, asking questions directly to Verity, I think would be a good idea. But theoretically, yes, you could.
All right, we have time just for maybe one more question.
While someone's putting that in there, I would just share, I don't think I explained my Balto is a foundation. It's a nonprofit. And so any clinic that sets up their angel fund there, the donations are tax deductible for the donor. And they have nice tools to help like at Roundup, like at checkout, which is how PetSmart Petco, right, have all those funds to donate to wonderful programs called PinPad there, but Roundup. So would you like to donate $135 into our angel fund? And so it's held at a foundation. The clinics can use it when and how they need. Person who brought up private equity, there's one company that the vets have an angel fund, but it's limited to $1,200 and it could take 7 to 14 days, I think it is. And I might be saying that wrong, so I won't say the name of who. And I spoke with a veterinarian at WVC who was like, we need this because they're like, the animal is gone and gotten care or died at that point. So with the cases that she sees, she's a specialist. And so the only thing you can't use the funds for are like cosmetic procedures, but otherwise the clinic has the power to use those funds and deploy them when and how needed. And, we just haven't had a good vehicle of philanthropy. Communities care about helping people keep their pets, care about helping people provide life-saving care for their pet, but we haven't had, because nonprofits are nothing but a vehicle of philanthropy. We're a vehicle of care. Right, but we haven't built that infrastructure. I always say, look at the United States and imagine no highways. That's what we've done for access to vet care, and that we haven't gotten the funds where needed in these hospitals where the care is being provided. So we're really excited by that component of the initiative because we need to build more infrastructure there so that pet families, hopefully we have fewer animals in our rescues and shelters because people gave them up because they couldn't afford care. And I've been at the desk of a shelter getting animals handed to me and working out every situation I could to get that animal back with their person. But, hopefully that is all being reduced for the rescue that was in the question.
Well, just a couple last minutes, but we don't have any more questions. Any final comments, ladies?
Amber?
I just
Yeah,
want to say thank you for letting me share our experiences. And I talk about it all the time. When I went to Vegas last week, I told everybody that I spoke to, I'm like, I don't work for any of these organizations, but I'm so passionate about what they can do for veterinary medicine and animal welfare that I just want everybody to know about it. And so it's just, I applaud you guys for letting me share this.
well, thank you, Amber, so much for being a part of the study and be willing to then take additional time to help disseminate results, share your experience. It's so powerful for people to be able to hear from you and connect with you. And thank you for the honesty of some of the challenges that you faced in the beginning, with building staff buy-in. And we saw that in the data. So we just welcome people to reach out to us. If you have any questions after this or something comes to your mind, I have our contact information on the next slide. So here is Amber's email. There's Pets Clinic's website. There's my email, and you can find me on LinkedIn. Amber says, she doesn't have time to keep that LinkedIn up to date, so not contacting her via email is going to be the best way. And
Well,
we're so appreciative to T for inviting us to be able to share this with all of you. And hope that we will keep in touch, and we look forward to continuing to share what we're learning and having it serve what we're all trying to do.